Hello, my name is Susan Blank, and I'm a doctor who works with the Virginia Department of Health. Thank you for joining me for this learning session, which is part of the Virginia Healthy Hearts Initiative. Today, our topic is hypertension, and we'll be talking about how to prevent and control high blood pressure. Let's get started. We're going to start by discussing the connection between hypertension and cardiovascular disease, then review the basics of hypertension, talk about the risks of uncontrolled hypertension, and finish by discussing how to prevent and manage hypertension. Hypertension is the #1 controllable risk factor for heart attack and stroke. It's sometimes called the silent killer because hypertension rarely causes symptoms, so it's not unusual for the first sign of hypertension to be a heart attack or stroke. Hypertension is very common. 1 in 2 American adults have high blood pressure, and unfortunately, because of the lack of symptoms, around 40% of people who have hypertension don't even know that they have it, and 4 out of 5 American adults who have high blood pressure do not have it under optimal control. This means that there are a lot of people walking around with blood pressures that are high enough that they're doing ongoing damage to their heart and blood vessels. The good news is that knowing and controlling your blood pressure can significantly reduce your risk of heart attacks and strokes and improve your overall health. Now that you understand the connection between hypertension and cardiovascular disease, we're going to move on and discuss some of the basics of hypertension. Blood pressure is the pressure of the blood pushing up against the artery walls. And here we see a diagram of an artery with red blood cells flowing through it. And as the blood flows forward through the artery, it's also exerting pressure up against the artery walls. And the blood pressure is made up of 2 different numbers. The top number is the systolic blood pressure, and that reflects the pressure against the artery walls when the heart is contracting. And the bottom number is called the diastolic blood pressure, and that's the pressure against the artery walls when the heart is relaxed. Blood pressure readings fall within a few different categories. A blood pressure is considered high blood pressure or hypertension if the systolic reading, that top number, is 130 or above, or if the bottom number, the diastolic reading, is 80 or above. It's considered elevated blood pressure if the systolic reading, the top number, falls between 120 and 129, and the bottom number falls under 80. And it's considered normal blood pressure if the top reading is under 120 and the bottom reading is under 80. It's important to know that a blood pressure reading where the top number is over 180 or the bottom number is over 120 can represent a medical emergency. If that type of blood pressure is accompanied by any symptoms, including chest pain, shortness of breath, headaches, vision changes, numbness, or weakness, 911 should be called immediately so the person can get emergency care. Even if the person is not having any symptoms, it's something to take very seriously. The person should sit quietly and have their blood pressure rechecked. If it's still elevated in that same range, their primary care doctor should be called immediately so that the person can get further guidance on how to get their blood pressure down. There are some factors which can increase the risk for hypertension, and these fall within a few different categories. In the demographic category, age is a big one. As we get older, our arteries stiffen, which causes the blood pressure to rise. And it turns out that if you look at the population over the age of 65, around 70% of people will have hypertension. So this is something that most of us are going to have to deal with at some point if we live long enough. Genetics and family history can also play a role. There are some medical conditions which can increase the risk of hypertension. These include diabetes and overweight and obesity, and then there are some lifestyle factors that can increase the risk of high blood pressure. These include eating a diet which is high in sodium and low in potassium, physical inactivity, high alcohol intake, and smoking. The good news is that with the exception of age and genetics, all of these risk factors are modifiable to some degree, which means that there are things that we can do to lower our risk and improve our health. Now we're going to talk about the effects of high blood pressure on the body and the risks of uncontrolled hypertension. High blood pressure overloads and damages both our blood vessels and our hearts. And I think it can be very helpful to think of the analogy of a water hose. So if you have normal water pressure, you get a nice, even, controlled flow of water through the hose. However, if you crank up the water and get really high water pressure, you start to see a lot of stress and strain on the walls of the hose, and also a lot of pressure exerted on whatever is at the end of the hose. In this case, it's this poor guy's face, but in our bodies, it's unfortunately our hearts. High blood pressure can damage the blood vessels in a few different ways. The first is that it can cause something called atherosclerosis, and this happens when the high blood pressure damages the internal lining of the blood vessel, leading to the buildup of plaque. And as you can see here, the plaque can grow to the point where it starts to restrict the flow of blood through the blood vessel. Eventually, it can get bad enough that the blood vessel gets blocked entirely. And if this happens in the heart, it can cause a heart attack. And if it happens in the brain, it can cause a stroke. High blood pressure can also lead to aneurysms, which are kind of ballooning out or outpouchings of the artery wall at places where it's weak and has been exposed to that high blood pressure over time. And if the high blood pressure continues, it can lead these aneurysms to rupture and bleed. In the brain, this causes a different kind of stroke. And in the eyes, it can lead to vision loss. And in the big blood vessels in the body, it can lead to catastrophic internal bleeding. High blood pressure also negatively affects the heart. Each time the heart beats, it's having to work against all of that extra pressure. Over time, this leads to the heart walls becoming thicker and stiffer and being unable to pump blood effectively through the body, and this leads to something that's called heart failure. Uncontrolled hypertension can do damage throughout the body. In the brain, it can cause the blood vessels to become blocked or to burst, leading to stroke. It can damage the little blood vessels in the brain, leading to memory loss and dementia. In the eyes, damage to the little blood vessels can lead to vision loss. In the heart, that extra workload on the heart can lead to heart failure, and blockages in the blood vessels in the heart can lead to heart attacks. In the kidney, damage to the little blood vessels can lead to kidney disease and kidney failure, including the need for dialysis. And high blood pressure is also one of the leading causes of erectile dysfunction in men. Now that you understand the risks of hypertension, we're going to move on and talk about how to prevent and control it. There are three main steps in preventing and managing hypertension. The first is to know your numbers. The second is to live a healthy lifestyle, and the third is to take medications if needed, and we're going to break down all three of these. The first step is to know your numbers. Because high blood pressure doesn't usually cause symptoms, checking your blood pressure is really the only way to know if it is too high. All adults should have their blood pressure checked at least once a year. Ideally, this would happen in the setting of an annual physical, but you can also get it checked at pharmacies and at community screenings. And if you do have high blood pressure, consider home monitoring. It's something that's easy to do and can be a wonderful tool in helping you and your doctor to get and keep your blood pressure under good control. The next step is to live a healthy lifestyle, and this has a number of different components. It involves eating a healthy, low-sodium diet, being physically active, maintaining a healthy weight, not smoking, limiting alcohol, managing stress, and getting a good night's sleep. If the goal is to prevent or control high blood pressure, one of the most helpful things that you can do from a dietary standpoint is to reduce your intake of sodium. And the majority of sodium that we take in is in the form of salt. Unfortunately, the American diet is incredibly high in sodium. 9 out of 10 Americans are eating too much sodium each day, which is putting them at higher risk for high blood pressure, heart disease, and stroke. The recommended limits for sodium for the general population are to keep it under 2,300 milligrams a day, which is the equivalent of around 1 teaspoon of salt a day. And for people with increased cardiovascular risk, including people with high blood pressure, the recommendation is to keep it under 1,500 milligrams a day, which would be under around 3/4 of a teaspoon of salt a day. And just for reference, the average American is taking in around 3,400 milligrams of salt, so over 2 times that 1,500 milligram limit for people who have high blood pressure. If you're going to be monitoring your sodium intake or trying to choose lower sodium options, it's helpful to be able to find sodium on the nutrition label. Here's an example of a nutrition label like you would see on packaged foods that you would get at the grocery store. And sodium is usually found about halfway down the nutrition label in the list of nutrients. And there are 2 different numbers that you'll see next to sodium. The first is a number of milligrams. So this is what you're going to want to pay attention to if you're trying to add up your total over the course of the day and see if you're keeping under that 2,300 milligrams or 1,500 milligram limit. And then the other number that you see, which can be helpful, is the percent of the daily value. The important thing to note with sodium is that the percent daily value is calculated based on the 2,300 milligram limit. So it can be helpful to look at to total up to under 100% if you're using the 2,300 milligram limit. However, if you are at higher risk for heart disease and you're trying to keep it to under the 1,500 milligram limit, this is actually going to underestimate things. For example, while this is 850 milligrams is 37% of the 2,300 milligram limit, it would be 57% of the 1,500 milligram limit. One of the tricky things about trying to lower salt intake is that actually very little of the salt that we take in each day is coming from salt that we are shaking on from the salt shaker either at the table or while we're cooking. It turns out that over 75% of sodium intake comes from processed and restaurant foods. Given this, there are a few different things that we can do to help lower our sodium intake. The first is just to eat more whole unprocessed foods like fruits and vegetables that are naturally low in sodium. The next is to cook more at home. When we cook at home, we have control over how much salt is going into our food. And when we do eat processed and restaurant foods, it's important to read nutrition labels and choose lower sodium options. Another good thing to do is to try to limit your intake of the American Heart Association Salty 6. These are foods that are consistently found to be high in salt. They include bread and rolls, cured meats, canned soup, sandwiches, pizza, and burritos and tacos. In addition to lowering the sodium intake, it can also be very helpful to increase potassium intake. Potassium can help lower blood pressure by counteracting the effects of sodium and also relaxing blood vessel walls. The recommended intake of potassium each day is between 2,600 milligrams and 4,700 milligrams, and the ratio of potassium to sodium is also important. You may have noticed from those numbers that we should be getting in more potassium than sodium each day, but in reality, most Americans are doing the reverse and getting in quite a bit more sodium than potassium. Potassium can be found in a wide variety of foods. It's found in a lot of fruits and vegetables, and some high potassium fruits and vegetables are shown here. On the fruit side, it's found in high levels in bananas and citrus fruits like oranges, and on the vegetable side, there are high levels in potatoes, broccoli, avocado, and cooked spinach. It's also found in dairy products and meat. And one thing to consider is swapping out your table salt for a potassium-enhanced low-sodium salt substitute. These can be found in the grocery store in the same area as the salt and spices and can be a good way to both increase your potassium and lower your sodium intake at the same time. One word of caution, however, excess potassium is removed from the body by the kidneys, and it can be harder to remove as we get older or if we have kidney problems or are on certain types of medications. So it's important to consult with a healthcare provider before altering your potassium intake if you have any history of kidney problems. There is one particular diet called the DASH diet that was designed to lower blood pressure. DASH stands for Dietary Approaches to Stop Hypertension, and this diet has been shown in research studies to lower blood pressure, cholesterol, and overall cardiovascular risk. The DASH approach to eating consists of eating primarily vegetables, fruits, whole grains, fat-free or low-fat dairy, fish, poultry, beans, nuts and seeds, and vegetable oils, and limiting fatty meats, full-fat dairy, sugar-sweetened beverages, sweets, and also sodium intake. If you're interested in more details about the DASH diet, I've listed the NIH website here, which is a good source of more information on DASH. It's also important to be physically active. Physical activity lowers the resting blood pressure and improves heart health. It can also help with other factors like weight and stress. The recommendations are that people should try to get at least 150 minutes a week of moderate intensity physical activity. Moderate intensity means a level at which you could carry on a conversation but not sing. So walking can be a great exercise for a lot of people, but the key here is to really find something that you enjoy and can stick with. It's also recommended that everybody do moderate to high intensity muscle strengthening activities at least 2 times a week. And there's some recent research that shows that isometric exercises like planks and wall sits seem to be particularly effective at lowering blood pressure. You can see some pictures of the positioning for these on the right. The goal would be to start by trying to hold these positions for around 20 seconds and then gradually build up to where you can hold them for 2 minutes at a time, and then to try to do 4 repetitions of each of these with some breaks in between 3 to 4 times a week. I think it's important to note that physical activity is a place where you should really focus on progress, not perfection. So start where you are and try to gradually build up till you're meeting these goals. It's important to try to maintain a healthy weight, and it turns out that even modest weight loss is associated with significant improvement in blood pressure. Each 1 kilogram of weight loss is associated with a 1-point drop in both the systolic and diastolic blood pressures, and 1 kilogram is the equivalent of around 2 pounds. So that means that if you lose 10 pounds, you can expect to drop your blood pressure by around 5 points, and if you lose 20 pounds, you can decrease your blood pressure by around 10 points. High blood pressure is one of many reasons not to smoke. Each cigarette raises blood pressure for at least 15 minutes after it's smoked, and smoking also damages the blood vessels in ways that increase blood pressure chronically. And it's also very important to limit alcohol to no more than 2 drinks a day for men or 1 drink a day for women. Higher levels of alcohol intake than that have been associated with elevated blood pressure. Getting a good night's sleep is also very important because getting too little or poor quality sleep can lead to higher blood pressures. You should aim to get 7 to 9 hours of sleep a night. And there's a particular sleep disorder which is quite common called sleep apnea, which is associated with hypertension. So you should talk to your doctor if you have any symptoms of sleep apnea. Symptoms can include loud snoring, pauses in breathing while you're sleeping, and being extra sleepy during the day to the point where you're falling asleep doing regular activities. Stress management is also really important, although easier said than done. Stress raises blood pressure and also makes it harder to maintain other healthy habits. And the key here is really to find something that works for you. It may be classic things like exercise, yoga, meditation, and breathing exercises, but it may also be listening to music or spending time in nature or with friends. The next step is to take medications if needed. Lifestyle factors can be very helpful and important, but realistically, we know that most people with hypertension will need at least 1 medicine to adequately control their blood pressure. So if you need medicine, you shouldn't look at it as a failure, but something that you're doing proactively to protect your health. The good news is that unlike many other areas of medicine, there are many safe, effective, affordable options. There are over 150 different blood pressure medications, many of them generics, so work with your healthcare provider to come up with a plan that works for you. Of course, medication can't work if you don't take it. Sometimes it can be especially hard to stay on track with medications for conditions like high blood pressure that don't cause anything in the way of symptoms, so it's helpful to try to make things as easy on yourself as possible, and there are a few different tips for doing this. One is to try to take the medication at the same time every day. You can also try linking it to another daily activity. So put the medication by your toothbrush or by your coffee maker. You can also try setting reminders on your phone if you tend to get distracted and forget to take it, and set up auto refill with your pharmacy so you'll never run out of a medication supply. And if you're having any issues with side effects or cost, it's really important that you don't just stop your medication on your own, because that can be dangerous. You should talk with your healthcare provider or pharmacist to try to find other good alternatives. As we wind down, I want to shift for a minute and talk about how you can help prevent and control hypertension in your community. The first way is to lead by example. If other people see you actively taking control of your blood pressure, you may inspire them to do the same. Next, share and educate. Talk to your friends and family about the importance of blood pressure monitoring and control and how it can positively impact their health. You can help organize heart-healthy activities, including things like blood pressure screenings, cooking classes, and stress reduction workshops. And lastly, advocate for change by supporting policies for things like healthcare access, healthy food access, and food labeling that can make blood pressure control easier for everyone. To close, I want to summarize the key takeaways from this learning session. The bad news is that high blood pressure is a serious threat to health. It's associated with higher risks of heart disease, stroke, dementia, kidney disease, and erectile dysfunction, and can negatively affect the length and quality of your life. However, the good news is that control is possible and can protect your health so that you can enjoy the activities and people that you love. And there are 3 steps to this. The first is to know your numbers. The next is to live a healthy lifestyle. And the third is to take medications if needed. This concludes today's learning session. Thank you very much for your time and attention. I hope you've learned some helpful information about hypertension that will help you improve your own health and the health of your community. If you're interested in more information about hypertension and heart disease, I've included the address for the VDH website along with a QR code that will take you there. Thank you and have a great day.